Hello and thank you for tuning in. Today I'm going to cover shoulder bursitis. I've been asked to do this by a subscriber and asked to give some help as currently on isolation lockdown. This person is suffering with a lot of shoulder pain, been diagnosed as a bursitis, and this can be an extremely challenging condition. I found in clinic there's only a number of ways in which actually this clears up, and a lot of that is following the right advice. Not overusing the joint too much as well. So, a bursitis, inflammation of the bursa of the shoulder, which is like a fluid sac that reduces friction. It can be caused by repeated dysfunctional movement, by trauma, by excessive pressure. Infection can cause it, and underlying conditions such as gout and osteoarthritis and so on, which often lead also to dysfunctional movement. What I find is, I believe as well, is that the bursitis that is more biomechanical and dysfunctional, I think is very treatable. I do find the infective type doesn't tend to respond so well to treatment and therefore usually has to be referred out. Although that's only in clinic experience, that may not be absolutely 100%, but that's what I believe. And so when I'm treating this with clients, I always go with my own sort of set protocol. So to start with, and you will see conflicting information on the use of ice to treat. I have found that using ice is fundamental when treating bursitis, as well as addressing any dysfunctional movement. But as I say, if you're stuck in and you can't get out and see someone at the moment, or you want to attempt to treat it yourself, then get yourself an ice pack. Make sure you follow proper icing procedures. I wouldn't ice for more than about 10 minutes in one area. You can sometimes go longer, but if you don't know and you haven't ever iced before, obviously do get clearance from someone you know who is a medical professional, or don't go over 10 minutes. I would normally take the ice pack or pack of peas or whatever you're going to use out of the freezer, and I would wrap it in a tea towel or a plastic bag and leave it for a minute or two, because the ice can burn your skin. So don't go putting the ice on you and burning your skin. You've got to be very, very careful of that. But what I would do is I would have an ice protocol. So I normally say to my clients 2-3 times a day. For most bursitis, that's for at least a month. Especially greater trochanteric bursitis and sub-acromial bursitis. If you want to go less the ice route, obviously you can work more on postural correction, because in a lot of cases there's maybe an anterior movement of the shoulder, a pronation of the shoulder and a shortening of the chest. Not always, but quite often. So you can watch my mini series on desk work, setup and corrective exercises for posture. That would help you as well. But in most terms, I would say icing. I would normally give a hands-on approach, but as we said, can't do that. So what else could you do? You could assess the tendons and the other tissues around the area. So for instance, if you got a bit of a bursitis, tendonitis on the biceps tendon, it would be very tender here in the front. It's tender anyway, but it would be extremely tender if there's a tendonitis there. So you can maybe do a little bit of digital friction just over that tendon for about 60 seconds, about 60% strength, 60 seconds to 2 minutes, always within comfort. You're not aggravating yourself. You want to cause a little irritation, and then you want to ice it afterwards because you want to increase blood flow. But anything that is aggravating you, you do not do. You can also do the same into the rotator cuff muscle there. And if you tap along, you'll see the bony point here. And then you just drop off and you work into that area in the same way. A little bit of digital friction. 2 minutes of gentle irritation, about 60% strength, and then ice it. But most importantly, the ice needs to be for a prolonged period of time. You want to avoid direct pressure. You don't want to be doing heavy, excessive lifting movements. You do kind of want to keep a little bit of mobility in there. Hard to give it fundamental when everyone's problem is going to be different. So for some people, they might be able to get a bit higher. Some people might literally just be moving in this range. Also be aware of other conditions. Be aware of possible frozen shoulder or adhesive capsulitis. Be aware of rotator cuff injury, tendonitis and impingement, and even tear. But you do want to try and keep it moving, because the more you restrict the movement of that shoulder, the more likelihood or chance there is of adhesive capsulitis starting. And you don't want a frozen shoulder. Believe me, they're not nice. So yeah, do the 30 days or more of icing until the bursitis is gone. It does work. I had a client who was actually put in for a hip replacement, and upon examination, just although there was some wear and tear in the joint, I just didn't feel that was what was causing the pain, and it was actually the greater trochanteric bursa. So we did this treatment for her. It actually took 2 months of regular icing, hands-on work from myself as well, massaging and working around the bursa and the leg, and working on reintegrating good function and good movement, and working around the pelvis as well to help the function of the hip, which would be the same with the shoulder. You would work around the neck and the rib cage. And yes, she ended up not having the surgery. Her pain cleared up from the bursa, and I think she ended up actually having the hip replacement 4 to 5 years later. So it wasn't actually pain coming from the hip at that point, which meant we gave her hip a bit more life. So obviously, in a lot of cases, the hip can cause pain around the area. So this is all about just getting the right structure that's causing the pain, and also working on the functional movement. So I hope that helps. If you have any questions, put them below, and I can try and answer those for you. But please do always get checked out. If you're going to do anything more invasive or more forceful on the joint, then make sure you get some advice from a medical professional. Take care, look after yourself, and be well. Subscribe above, follow on Instagram, Facebook, and LinkedIn. Have a good day.